Millions of men are living with a silent killer inside them, prostate cancer, and they don't even know it. This disease doesn't start with a warning. There's no sharp pain, no obvious lump, and no dramatic symptoms. It grows quietly, slowly, until one day it's no longer curable. But here's the truth, it doesn't have to be this way. You have more control than you think, and early detection could be the one decision that saves your life. Did you know that 1 in 8 men will be diagnosed with prostate cancer in their lifetime? And this year alone, in 2024, over 299,000 new cases are expected in the US alone. Even more heartbreaking, more than 35,250 men are projected to die from it. These are not just numbers, they're fathers, brothers, husbands, and sons. And many of them never saw it coming. But when caught early, prostate cancer has a 5-year survival rate of over 97%. That's why you can't afford to ignore the warning signs. If you've noticed changes in your body, even small ones, it's time to stop brushing them off. In this video, we'll walk you through 8 early signs of prostate cancer that you should never overlook. Because your body is always speaking to you, and sometimes, it's begging to be heard. Your health, your life, and your future are worth paying attention to. 1. Numbness and weakness in limbs. Numbness or weakness in your limbs is a serious symptom that should never be ignored. While these sensations can have various causes, they could indicate advanced prostate cancer that has spread to the spine and is compressing the spinal cord. When prostate cancer metastasizes, it often targets the bones, including the vertebrae. This can lead to spinal cord compression, which disrupts the nerves responsible for movement and sensation in your arms and legs. You may notice a tingling sensation, loss of strength, or even complete numbness in the affected limbs. This condition doesn't stop at the limbs. If left untreated, spinal cord compression can also lead to problems with motor function, making simple tasks like walking or lifting objects difficult. Additionally, it may cause loss of bladder or bowel control, a sign that the situation has become more severe and requires immediate medical intervention. These neurological symptoms are a clear indication that cancer has progressed to an advanced stage, and swift action is crucial. Ignoring these signs could lead to permanent nerve damage or paralysis, making early diagnosis and treatment vital. 2. Unintentional weight loss. Sudden, unintentional weight loss can be alarming, especially if you haven't made any significant changes to your diet or activity levels. While some may dismiss it as a welcome surprise, it's crucial to understand that unexpected weight loss can be a sign of something more serious, like prostate cancer. What causes this? When cancer cells spread, they can disrupt your body's normal metabolic processes. These cells demand a lot of energy, essentially stealing nutrients from your body to fuel their growth. This metabolic imbalance can lead to rapid and unexplained weight loss, often accompanied by persistent fatigue. Unlike intentional weight loss from diet and exercise, this kind of weight loss happens without effort and can leave you feeling drained, even if you're eating normally. It's your body's way of signaling that something is off. This symptom is particularly concerning when paired with other potential warning signs of prostate cancer, such as pelvic pain, changes in urination, or blood in your urine or semen. Sudden weight loss is a red flag that warrants immediate medical attention. It's easy to overlook or rationalize these changes, especially in the hustle of everyday life. But your health is too important to ignore. If you're experiencing unexplained weight loss along with other symptoms, consult your doctor. 3. Swelling in legs or feet. Swollen legs might not be the first thing you associate with prostate cancer, but they should make you pause. especially if that swelling is persistent, painful, or comes with skin that feels tight and looks different. In 2024, a study published in Cancer Medicine found that over 21% of men diagnosed with metastatic prostate cancer reported lower limb swelling as one of their initial warning signs. It's not rare. And it's not random. This type of swelling, known as edema, happens when fluid builds up in the tissues of your legs and feet. One reason? Cancer cells can block the lymph nodes that normally help drain excess fluid from your body. When prostate cancer spreads, it often targets nearby lymphatic channels, especially in the pelvic region. Once those lymph nodes are clogged or damaged, the fluid backs up like a dam, leaving your legs heavy, swollen, and tight. Of course, not all leg swelling means cancer. Heart failure, kidney disease, or even sitting for long periods can cause similar symptoms. But here's the difference: swelling from cancer doesn't go away with rest, often gets worse over time, and may be accompanied by pain, inflammation, or skin texture changes. If you're noticing swelling alongside other prostate cancer warning signs, like urinary changes, fatigue, or bone pain, this is your body waving a red flag. Don't ignore it. It might seem small, but it could be the earliest clue your body gives you. And catching it early could save your life. 4. Pain in back, hips, or chest. Persistent pain in your back, hips, or chest can be a red flag that something serious is happening in your body. While aches and pains in these areas are often attributed to aging or overexertion, they can also indicate a more concerning issue: prostate cancer that has metastasized to the bones. When prostate cancer reaches an advanced stage, it can spread beyond the prostate gland, often targeting the bones. This can lead to persistent, deep-seated pain in the lower back, hips, or even the chest area. Unlike typical muscle or joint pain, this discomfort doesn't improve with rest and may worsen over time. The presence of bone pain is a significant marker of advanced stage cancer, and it requires immediate medical attention. It's also a key indicator that the cancer has moved beyond the prostate, potentially affecting other parts of the body. Ignoring this type of pain can lead to delays in diagnosis and treatment. If you're experiencing persistent pain that doesn't respond to usual remedies or seems to worsen, don't dismiss it as just a sign of aging or strain. Prostate cancer that has spread to the bones is more challenging to treat, but catching it early can make a huge difference in managing the disease and improving your quality of life. Pay attention to your body and seek a comprehensive medical evaluation if you notice these symptoms. It's always better to be safe than sorry. 5. Pain while sitting. Experiencing pain or discomfort while sitting may seem like a minor annoyance, but it could be an important warning sign of prostate cancer. This discomfort can range from mild, nagging aches to sharper, more intense pains concentrated in the pelvic region. Why does this happen? The prostate is located just below the bladder and in front of the rectum, so when it becomes enlarged or affected by a tumor, it can create pressure points in this area. In more advanced stages of prostate cancer, the disease may spread to surrounding tissues, intensifying the pain and making simple activities like sitting down feel unbearable. This type of pain might also radiate to the lower back, hips, or thighs, further complicating its origin. While other conditions, such as prostatitis or benign prostatic hyperplasia, BPH, can also cause pelvic pain, persistent or worsening discomfort should never be ignored. Pain while sitting is more than just a physical symptom. It can disrupt your daily life, making it hard to focus, relax, or even enjoy simple activities. If you're experiencing this regularly, especially alongside other symptoms like urinary changes or painful ejaculation, it's time to seek medical advice. prostate health is too important to overlook. Early detection can make a significant difference, so don't hesitate to consult your doctor and get to the root of the issue. Listening to your body can be the first step toward protecting your health and well-being. 6. Blood in urine or semen. Seeing blood in your urine or semen can be alarming, and for good reason. It's a signal that something isn't quite right. This condition, known as hematuria or hematospermia, can appear as visible streaks of blood or sometimes only be detected under a microscope. Either way, it's important to take it seriously. What causes this? In the case of prostate cancer, the presence of blood often results from vascular damage or tumor growth within or near the prostate gland. As the tumor develops, it can disrupt surrounding blood vessels, leading to bleeding that mixes with urine or seminal fluid. However, it's important to know that cancer isn't the only possible cause. Blood in your urine or semen can also result from infections, inflammation of the prostate, prostatitis, or even a urinary tract injury. That said, these conditions should never be self-diagnosed or ignored. Why is this symptom so urgent? While not every instance of blood is due to cancer, it's impossible to know without proper testing. Ignoring the issue could delay treatment for a potentially serious condition. The sooner you consult a doctor, the better your chances of identifying and addressing the underlying cause. 7. Painful ejaculation. Now let's talk about another potential warning sign that often gets overlooked: painful ejaculation. For many men, this can be an uncomfortable and even embarrassing topic, but it's one that shouldn't be ignored. If you experience discomfort or pain during ejaculation, it could feel localized in different areas: your penis, testes, rectum, or even your lower abdomen. While occasional mild discomfort isn't always a cause for concern, persistent or worsening pain could signal an underlying issue with your prostate. Why does this happen? The prostate gland plays a key role in producing seminal fluid, which mixes with sperm during ejaculation. When the prostate is inflamed or undergoing changes, such as those caused by cancer, it can disrupt this process and lead to pain or discomfort. It's important to note that painful ejaculation can result from other conditions like prostatitis, inflammation of the prostate, or benign prostatic hyperplasia, BPH. However, when paired with other warning signs, like urinary problems or frequent nighttime urination, it could point to something more serious, including prostate cancer. This symptom can significantly affect your quality of life, from physical discomfort to anxiety about your health. If you're experiencing this regularly, it's crucial to consult your doctor. Open conversations about these issues can lead to early detection and treatment, potentially saving your life. Remember, no symptom is too small when it comes to your health. 8. Frequent urination and nocturia. Have you noticed that you're heading to the bathroom more often, especially at night? Maybe it's interrupting your sleep and leaving you feeling drained during the day. Frequent urination or nocturia, waking up multiple times to urinate, can be one of the earliest red flags. Why does this happen? The prostate gland sits just below the bladder and surrounds the urethra, which is the tube that carries urine out of the body. If the prostate becomes enlarged, it can press on the urethra, making it harder for urine to pass. This leads to increased frequency and urgency, even when your bladder isn't full. It's worth noting that aging in conditions like an overactive bladder or benign prostatic hyperplasia, BPH, can also cause these symptoms. But here's the key: if you notice persistent or worsening changes, don't dismiss them as just getting older. This is your body's way of signaling that something might not be right. Remember, early detection can significantly improve your outcomes. So, if you're experiencing these disruptions, especially alongside other unusual symptoms, it's time to talk to your doctor. A simple check could give you peace of mind, or save your life. Stay tuned for the next signs you should watch for. Understanding what puts you at risk for prostate cancer isn't just good to know, it could save your life. Age is still the biggest factor. After age 50, your risk rises sharply, and more than 60% of new prostate cancer cases in 2024 will be diagnosed in men over 65. That's why routine screenings become increasingly important as you get older, but genetics matter, too. If your father, brother, or even mother had prostate or breast cancer, your chances of developing it nearly double. Inherited mutations, especially in the BRCA1 and BRCA2 genes, can silently increase your risk without you even knowing it. It's not just what's in your DNA, it's who you come from. And the statistics are even more troubling for African American men. In 2024, Black men in the U.S. are 1.7 times more likely to be diagnosed with prostate cancer, and twice as likely to die from it, compared to white men. The causes are complex, involving not only genetics but also systemic disparities in access to healthcare, earlier detection, and lifestyle support. Speaking of lifestyle, that's the part you can control, and it matters. Carrying extra weight, especially around your waist, has been linked to more aggressive forms of the disease. Diets high in processed meat, saturated fat, and sugar, paired with little or no exercise, create the perfect storm for cancer to thrive. But here's the good news: you can fight back. Eating a diet full of cruciferous vegetables, berries, tomatoes, and healthy fats can lower inflammation and reduce risk. And just 30 minutes of moderate activity, like walking or cycling, 3 times a week, can shift your hormones, improve immunity, and make a real difference. You can't change your age or your genes, but you can change your habits. And that might be enough to tilt the odds in your favor. Knowledge is only power if you use it, so stay informed, stay active, and talk to your doctor. Awareness today could be the reason you're here tomorrow. Taking control of your health doesn't require a miracle, it starts with simple, daily choices. And when it comes to prostate cancer, those choices matter more than ever. You may not be able to change your age or your genes, but you can change what's on your plate, how often you move your body, and how willing you are to ask your doctor the hard questions. A diet rich in colorful vegetables, antioxidant-packed fruits, and clean proteins isn't just good for your waistline, it's your frontline defense. Tomatoes, broccoli, leafy greens, these are your allies. And exercise? Just 30 minutes a few times a week can reshape your hormonal balance, boost immunity, and reduce your risk dramatically. Staying lean and active doesn't just make you feel better, it could save your life. But prevention isn't just about what you do, it's also about what you don't ignore. If your father, brother, or son has had prostate cancer, talk to your doctor. If something feels off, whether it's in the bathroom, your energy, or your weight, don't wait. The earlier you act, the greater your chance of full recovery. Early-stage prostate cancer is one of the most treatable cancers in men. But only if you catch it. You are not powerless. You are not alone. You are not too late, unless you choose to be. So be bold. Be smart. Be vigilant. If anything in this video hit close to home, take the next step, book the checkup, change the habit, start the conversation. And if this video helped you, help someone else. Share it. Send it. Talk about it. Hit that like button, subscribe for more real conversations about real health, and together let's stop prostate cancer from taking more lives in silence. Your body is speaking. Don't wait until it's screaming.